the patient did get a good idea about how she will look, and she did agree to go ahead with the surgery. Of course, we planned both the genioplasty and the buccal fat removal in the same sitting.
Buccal fat removal is a very simple procedure. Normally, we can do it under local anesthesia. It hardly takes us 10 to 15 minutes to remove the buccal fat. But in her case, we combined the buccal fat with genioplasty. So buccal fat was also removed by giving the incisions inside the mouth. There were no incisions outside.
Hello friends, I'm Dr. Shreya Krishna, a maxillofacial surgeon with Team Aesculpir, bringing about the best facial aesthetics in town. Sitting with me today is Dr. Henna Kudyar, a cosmetic and plastic surgeon with Team Aesculpir. Today we're discussing a very unique case with all of you about a young female patient who came to us with a very broad complaint saying she has a very short and chubby looking face. So Dr. Heena, let's tell everybody about how we treated this patient and transformed her face.
So hello friends, so as you all know that today we are discussing a face which is short and chubby, and this young female came to us with only these complaints. She was not aware what procedure she should undergo, but her only expectation was that she wanted a long and a slender looking face. So I think looking at the photographs of this patient, we can see that she had very good and prominent cheekbones, but her main concern was that her cheeks were very full. I think maybe because of more buccal fat. So buccal fat is normally present in all of us, but in her case she had a large, maybe a little more of buccal fat which was there, and then she had a square jawline with a short and a less projected chin. I think Dr. Shreya would agree with me that these were the findings which we as experts could see in her. So we are a team of 2 plastic surgeons and the maxillofacial surgeon Dr. Shreya, who is with me today. So we all discussed all these things in detail with her.
So after our board sat down and we came up with a treatment plan for the patient, we called her in. We kept the first consult purely to tell the patient what treatments we have for her and what is most suited for her. So the first consult was just, we were just talking to the patient. We were understanding primarily what is her expectation. Is she looking for a very huge transformation, or is she looking for something very small that can, give her a very big change? And what we communicated to her was that by doing a sliding genioplasty along with that buccal fat removal to get rid of that excess chubbiness on her cheeks, we felt that she will get that long, slender, slim looking face, which is why she came to us in the first place. So what was very important, what we felt, that being a young female, the kind of concerns she had in her first consult were about the recovery period, about the amount of pain she's going to have, how long she's going to have to be on leave, and how much the face will change, because naturally it is very easy to feel conscious about what you have, but it makes you even more conscious to think that you're going to be transformed, but you have to meet the same people in your day-to-day life. So that entire process is what we focused on when we met her for the very first time. And then of course,
I think after listening to her complaints, what are her expectations? So we as experts, we always look for the various modalities by which we can assess how she will look after the surgery. So we did the virtual surgical planning for her, just to understand and give her an idea how will she look after the surgery. Now basically this virtual surgical planning is only done to assess the post-operative bony framework, I think. Yes. So we cannot assess the soft tissue result with this virtual surgical planning. So it's only the bony framework which we can assess pre-operatively, how much lengthening which we can do, how much projection which we can give to the patient. So all these things were done in her, and this is how we planned her for the surgical procedure ahead.
Yeah, and the patient did get a good idea about how she will look, and she did agree to go ahead with the surgery. Of course, we planned both the genioplasty and the buccal fat removal in the same sitting. So, genioplasty is something that we do as daycare. We admitted her in the morning, we let her go the next day. The surgery lasted about 2.5 hours. We were done with both the procedures. We did the buccal fat and the genioplasty together. In the genioplasty, we did the surgery from completely within the mouth. We left no scar on the outside. We were able to achieve exactly the amount that we planned in the virtual surgery. The nerves that supply the chin, which are very commonly affected in the surgery, were completely preserved. So today the patient has absolutely no numbness, no pain because of our procedure. And we gave her very fine plates made of titanium to keep the new chin in that projected and long position. And we did the closure with resorbable sutures or resorbable stitches, so that we don't have to separately remove the stitches. And Dr. Henna and Dr. Diksha, they did the buccal fat removal.
Yeah. So buccal fat removal is a very simple procedure. Normally we can do it under local anesthesia. It hardly takes us 10 to 15 minutes to remove the buccal fat. But in her case, we combined the buccal fat with genioplasty. So buccal fat was also removed by giving the incisions inside the mouth. There were no incisions outside. Very precisely we removed just the appropriate amount of extra fat which is there, which was giving her the fuller appearance. So we just removed that fat, and we could see that it definitely enhanced her cheekbones in the post-operative follow-up period when she came to us. So this is just a simple procedure which can give you dramatic results, I suppose, right?
Yes, absolutely. So, just in a matter of 3 weeks, we saw, a short and chubby looking girl, having such a long, slim face. And I don't know, is it as doctors we think, but overall when you look at her, the personality just became more graceful and slender.
Now she was more confident in her looks also.
She was so confident.
Yeah, earlier she used to be a little quiet and timid, but now I can feel the confidence in her looks now, with, I think, maybe with the surgical procedure which we have done.
Yes, and it took just about 3 weeks for her swelling to go, for the numbness, discomfort to go, and she was already munching on her usual roti, chawal, pizzas, everything. So these small procedures go a long way if they're very well planned, and of course if they're done by experts.
Yeah, I think Dr. Shreya would agree with me that most of the patients nowadays, it's an emerging trend for facial contouring. They are very conscious about their facial aesthetics, facial proportions. So whenever these patients, they come to us, the most important thing is that we have to make them realize which procedure is best suited for them, and which can give them the best results, and by doing the minimal amount of surgical procedure or other procedures which they can get the best results out of that, I think. And not only the females, even the males are coming with these problems, and I think they also get the best results with all these surgical procedures.
I hope this video was able to give a lot of people that clarity about what they want, and who are the real experts to help them achieve what they want. Short, chubby face, it can be square face, round face. There is a scientific solution to all problems, and wherever you find certified practitioners is what we feel as doctors is where you should go. I also would like to thank Dr. Heena for the really insightful discussion and her expert points, and for being the strength in this case. Thank you everybody for watching this video. If you have similar doubts or want to know in depth about other facial aesthetic procedures, please subscribe to our channel, like or leave a comment. Thank you.